Hello, good afternoon, everybody. Welcome to the Live Well Zone. My name is Jermaine Satya. I am an integrative nutrition health coach, and I help women to balance their hormones and to simplify the process through food, herbs, and mind body techniques. So, in today's live, I want to talk to you guys about testosterone therapy because this is a fairly confusing topic. It's something that is talked about in certain spaces. It's not super common, but depending on your phase of life, you may have heard about potential benefits around testosterone therapy. So I wanted to just give you guys an overview of this topic, what you should be aware of, basically just what the science and what the official position is on it. And then I'm also going to give you my opinion and some other options that you can use if you just need to support your testosterone levels in general. So the first thing that I just wanted to present is the fact that, as women, we definitely need to make sure that we maintain sufficient and healthy levels of testosterone. So this hormone is officially classified as the most abundant biologically active hormone in women. Okay, it is produced in different parts of the body, but primarily produced in the ovaries and the adrenal glands. And testosterone does a lot of things for us women, both physically, mentally, and emotionally. So we have receptors for testosterone and basically androgens, which are the male hormones. We have receptors for these hormones all over the body. So in breast tissue, in the heart, blood vessels, your GI tract, your lungs, your brain, your spinal cord, your bladder, your uterus, ovaries, all your endocrine glands, your vaginal tissue, your skin, bones, muscle, all over the body, we have receptors for androgens and specifically for testosterone. So it is super important for our health. And if for some reason you do find yourself in a situation where where you are having low testosterone, some of the potential symptoms that can come along with this are things like mood swings, anxiety or irritability, fatigue, bone loss, muscle loss. You can have memory loss and other changes in your cognitive function, insomnia, hot flashes, breast pain, incontinence, sexual dysfunction, basically, and also low libido, loss of sex drive. So all of those things are some of the potential symptoms that are associated with having low testosterone. Okay, now as far as the causes of low testosterone, there are different things that can happen here. So first thing that can potentially affect that is just purely your diet. So it could just be that you have a diet that is not giving your body sufficient nutrients to make enough of this hormone. Also, if you are consuming things that are known to mess with hormones in general, it will definitely mess with your testosterone levels as well. So here we're talking about things like alcohol, coffee, which can be a problem for some people, a lot of processed foods as a whole. Those will definitely affect your testosterone levels. And then also xenoestrogen. So these are going to be the synthetic forms of estrogen that we are exposed to throughout our daytime, and especially things like plastics, right? So plastic bottles and anything basically that has BPA in it. Also, stress can affect our testosterone levels for sure. And then there's also, interestingly, there is the use of birth control, especially long-term use of birth control. That can also affect our testosterone levels as women, because the thing with birth control is that birth control actually inhibits the production of testosterone in the ovaries and the adrenals. And then as that happens, it also increases the levels of a protein known as sex hormone binding globulin. So SHBG for short. Now, this protein is important because this is a protein that binds to all the sex hormones, including testosterone. Okay, so it binds to testosterone and carries it through your blood. So what happens here is that with birth control, like I said, we already have the ovaries and the adrenals that are basically not producing testosterone like they should because of their birth control. And then we now have an increase of this protein that binds to testosterone. So basically, it's going to now bind to the little bit of testosterone that you do have. And so the end result of that is that your free testosterone levels are going to go down. So that is another way in which testosterone levels can potentially drop for us ladies. Okay, so that's an overview basically of testosterone, why we definitely need it, and some of the ways in which it could potentially get too low. Now let's talk a little bit about testosterone therapy, because this is something that everybody has a different opinion on. So depending on the expert you talk to, some are very, very gung-ho about it, others not so much. So overall, here in the US, officially, there is no there's no testosterone drug that has been approved by the FDA for use in women. Okay. That said, it is clear that in some other countries, specifically in the UK and in Australia, the use of testosterone therapy is approved and has been used for over 60 years based on the information that I found. Now, what I don't know is the specific conditions or situations under which it is used in those countries. That I unfortunately don't have that information, but it is clear that at least in Australia and in England, that this is licensed. Here in the US, officially there is no drug specifically for women that contains testosterone. So that said, there are still doctors, there are still practitioners that will sometimes do testosterone therapy, and this is usually done in one of two ways. So either as a woman, you will either be given a testosterone drug that was made for men, but you will be given a lower dose of it, or your doctor could also basically write a prescription for bioidentical. So this is something that you would take to a compounding pharmacy and get your own specific blend of formula made just for you based on what your practitioner has prescribed. So those are usually the two ways in which testosterone therapy is going to be made available to you in the US specifically. Now, in addition to that, in terms of the evidence and sort of the approved uses of testosterone therapy for women, it really has been tested, or I should say studied more for things like hypoactive sexual desire disorder. So that's a big one. HSDD, so hypoactive sexual desire disorder / dysfunction. So this is basically a reduction in sexual desire that also comes with a lot of distress as a result of that reduction in sexual desire. And this is something that tends to occur more in women going through menopause, also post-menopause. That's not to say that it cannot happen also prior to that phase of life, but generally speaking, this condition tends to show up more at that time of life, and that is generally when testosterone therapy is offered as a potential treatment. Okay, and the thing to note here that is the International Menopause Society as well as the North American Menopause Society, they all state officially that basically when it comes to testosterone therapy for women, HSDD is the only condition for which there is sufficient evidence. So they do not support the use of testosterone therapy for things for maybe say bone loss or for fatigue or for cognitive changes in cognitive function. Things like that, they don't stand by that, but they do stand by the use of testosterone therapy specifically for this hypoactive sexual desire disorder. So that's just something to keep in mind as far as what the official statement is for this type of therapy. And it's also worth noting that this therapy is helpful for a woman who is going through menopause either naturally or because of surgery. Okay, so in either case, the testosterone therapy has been shown to be helpful for that particular condition. In addition, there are two more cases in which testosterone therapy may be helpful. So it may be helpful for sexual function in late reproductive aged women, and for women who also have a decreased desire and as a result of having, let's say, one or both ovaries removed, in that case, potentially testosterone therapy could be helpful. All right, so that in a nutshell is where things stand. Now, in terms of my own personal perspective of this, I always say that when it comes to hormone therapy of any kind, that you definitely want to make sure that you do sufficient research, ask enough questions, because the fact is, the moment we are playing around with external forms of hormones, there is always a risk associated with it. Okay, so my opinion in this is that just put it in the same bucket as any other form of hormone therapy, and be aware that you are now doing more manipulation of what's going into your body, and they can be, it could be good, could be bad. Like all forms of hormone therapy, it can help some women, and it can be incredibly, just it could be horrible for another woman. So there is no one size fits all in this particular case. And while we're on that topic, just so you're aware, if you are considering testosterone therapy, you also want to be aware of some of the side effects. So one of the major ones that can happen would be something like having an enlarged clitoris, acne, and we see this also in hormonal imbalance conditions that are associated with elevated androgens. So acne is a potential side effect, facial hair growth, potential changes in your voice, maybe deepening of your voice. There could also be some cardiovascular issues. And overall, depending on the person, it seems like it's not always possible to reverse those side effects. So in some cases, once those side effects show up, it is not always possible to reverse it, even when that therapy has been halted. So again, just something to be aware of. And I'm sharing all this with you just to say that it is an option that is out there that might be presented to you. It does help some women. It is approved in some other countries, so we also can't ignore that there are other parts of the world that are using this for women. So talk with your practitioner, do your own research, get informed, and understand exactly what's going on. Look into the type of testing that is also done for low testosterone. Be aware that the testing isn't it's not a foolproof test to look for low testosterone. And usually they're not looking necessarily just at the testosterone levels. They're actually going to look at the levels of that protein, that sex hormone binding globulin. So they're going to look more at the levels of that protein, because based on the levels of that protein, you can get an estimation of what's happening with testosterone. So that's usually how the testing goes for low testosterone. So that's the overview of what the science is and what your options are from a medical perspective. Now, if you do need to support your testosterone levels, there are, of course, natural options available to you. So the first thing would be working with a hormone-friendly diet. So even though we're talking about testosterone here, the same rules apply as to if you were trying to support estrogen or progesterone. You want to eat a healthy, balanced diet. You want to eat things like eggs, for example, lots of leafy greens, fatty fish, because the raw nuts, these have lots of fat. They're going to give you the raw materials to make more of testosterone, because like all sex hormones, you need fat as your raw material, specifically cholesterol. So make sure that your diet is overall hormone friendly. You can look into herbs, things like maca, for example. That is one herb that can help potentially. Maca does not contain any hormones, but maca does act on the pituitary gland, and the pituitary gland has communication with all of the other glands in the body, including the ovaries and there's a cascade. So from the pituitary to your thyroid and your ovaries and your adrenals. So there is communication that goes down that can help with the production of hormones and just balancing your hormones. This is probably why maca for women that are in menopause in particular seems to be also very, very helpful. So maca is one herb that can potentially help you to balance out those levels. Ashwagandha would be another one. Exercising, definitely, for sure. All exercise will help. Doing things like weightlifting can help significantly more. Anything with your body weight will be super, super helpful when it comes to making sure that you have healthy levels of testosterone. And then managing your cortisol levels, managing your stress, right? We're talking about cortisol, we're talking about stress. So whether it's stress from your diet, stress emotionally from your lifestyle, just looking at ways to manage stress and keep cortisol low. And then making sure that you're getting enough nutrients. So something like vitamin D, that is one that is very helpful for just hormone balance as a whole, making sure you're getting enough magnesium, vitamin C as well. That can come from your diet, that could also come from supplements. And then lastly, another natural option to look into is pine pollen. So this is pollen that is coming from pine trees, specific types of pine trees. So there's actually been some research that shows that that pollen actually contains plant forms of testosterone, and this is something that might potentially be safer. Again, just because it's natural doesn't always mean that you can just go crazy with it, but pine pollen is something to look into, and I'm going to go ahead and type that here into the chat. So that is an option, and you can find that on its own. Sometimes it comes in a formula with some other natural remedies, basically. So definitely look into pine pollen as a potential solution also if you actually need to boost your testosterone levels. Okay, so that's it for today's live. I hope that you found this information helpful. If you have any comments or questions about this, or if you yourself have gone through this, maybe you've had to do something, whether naturally or medically, however, to support your testosterone levels, feel free to leave a comment below, share your experience, because it will definitely help anybody else that is rewatching this video. Okay, so I see that we might have a couple of people here, so if there are any questions while I'm still on, go ahead and share. Otherwise, feel free to pop in your question when this replay goes back up on YouTube. Okay, thank you so much for watching, and I will see you guys on the next live. Bye bye.